Hi, and good evening, everyone. First of all, thank you for taking this time. I am Nicole Lim, a third-year medical student. Tonight, I will talk about OpenIMIS briefly and how OpenIMIS can be used to better the Health Informatics Management course in a medical school curriculum here in the Philippines. I first heard about OpenIMIS from Dr. Alvin Marcelo when he talked about the relevance of digital health in the General Assembly of the Asian Medical Students Association, or AMSA, last year. A few months ago, Ahan reached out to me, being one of the representatives of the local AMSA organization in our school, to talk about how OpenIMIS can be applied in the medical school setting. The learning objectives of this presentation is for us to obtain a basic grasp on the role of OpenIMIS and its advantages, especially in the Philippines setting. To briefly explore the basics of our health financing scheme based from the WHO Health Systems Framework, and to highlight the features of OpenIMIS that can improve the Health Informatics Management course in a medical school setting. Just a disclaimer, all views, comments, and opinions expressed in this presentation are from my perspective as a medical student and do not represent the views of any medical institution. So just a little throwback, early this year, when we still had on-site classes before the pandemic, this was during the OpenIMIS Training of Trainers workshop held at our school library with a handful of us students who are members of Access AMSA and the AHIN staff. So what is OpenIMIS? OpenIMIS stands for Open Source Insurance Management Information System. It is an open source software for health financing, currently being used for the health protection schemes in Cameroon, Chad, Democratic Republic of Congo, Nepal, and Tanzania. It links beneficiaries, health service providers, and insurance payers. And since we won't be discussing OpenIMIS in depth in this presentation, you can check out the links on the slide for more information. However, what you need to know is that you don't have to learn coding to use OpenIMIS. I myself am not a tech-savvy person, but it's already there, and all you have to do is customize it the way you think it is appropriate for the country's health insurance system. So what is the mechanism of this? There are four main processes of OpenIMIS. The first one is enrollment. So here, a family or a voluntary individual or the informal sector enrolls into the scheme. The basic personal information will be collected for identification, and then the member receives a membership card with QR codes. It has a centralized and localized storage of individual information through the ID number and policy and other information. The money and the personal information will then be collected to the insurer. The next step is accessing health service. And here, the involuntary member visits the health facility, and then the member shows the card in which the QR code is then scanned for verification. For diagnosis and services provided and needed treatment, these will then be incorporated onto the OpenIMIS to prepare the claim, which leads us to the next step, claims management. Here, the health facility submits digital claim to scheme operator by OpenIMIS. The billing processes and insurer are then connected by the central server. The operator also reviews the claim at OpenIMIS and approves the payment. So here we see payment approval, and then the money is then received for the treatment. Lastly, there is also the monitoring and reporting for the transaction. So in this slide, we see the WHO Health Systems Framework, and integrating OpenIMIS would naturally contribute to two of the WHO system building blocks, namely the health information systems and financing. And this together would contribute to the overall goals and outcomes like improved health, responsiveness, social and financial risk protection specifically, and improved efficiency, since transactions would be faster and more efficient for the payers, the patients, and the providers. So this slide shows a quote. While I was browsing through the global medicine part of the Harrison's book, which is like one of the Bibles in med school, in medicine, I saw this line and it became remarkable to me. It says, the predominant form of healthcare financing, which is charging patients at the point of service, is the least efficient and the most inequitable, tipping millions of households into poverty annually. Summarizing it into the three-letter P's, predominant, point of service, poverty, we can also add a fourth P, the Philippines, because it somehow describes our country in a way, and another P, which is our public health system, unfortunately, is what we see nowadays of how we're having this pandemic. So in this slide, we see the UHC cube on this top figure. So increasing coverage of health services can be considered in terms of three axes. The population covered, which is the breadth, who is insured, the range of services underwritten, here, depth, and the percentage of costs paid, which is the height or what proportion of the costs is covered. Moving towards universal health coverage requires ensuring the availability of healthcare services to all, eliminating barriers to access, and organizing pooled financing mechanisms such as taxation or insurance to remove user fees at the point of service. Because again, what we saw from the previous slide, point of service payment is what is contributing to the poverty of our country and the poor and weak public health system. So why does the Philippines need OpenIMIS? So first of all, it is designed for countries aiming for UHC, universal health coverage. It is free, so it can be used in low resource settings like rural areas and far-flung areas. It has a centralized electronic health record system, so it can lead to improved data management and storage. And also in our country, we have the need to have paperless transactions for accessibility. And this is very much applicable to the barangay health centers as they don't have a proper way of tracking patients or better yet, updating their records. In essence, most of them still use paper and of course it gets worn out over time, especially when the health center gets flooded or like an unforeseen calamity wipes out those vital patient records. Nowadays, also, people prefer to store their files in a cloud-based system so they can access such files when using different devices and also for backup. The challenge here is that the files still need to be subject to the Data Privacy Act, but that is beyond the scope of this presentation. Another reason why we need OpenIMIS is that this is relevant for research and public health statistics. Knowing which diseases are prevalent in specific areas and which diseases should be included in an insurance policy if it's not yet listed and people are not yet covered for it. Also, the features of OpenIMIS can expedite healthcare payment processes. And an example for this is it provides a price list for medical services and items, which is very helpful for the patients, most especially. So let's take a quick tour in the demo page of OpenIMIS. So here we see administration in the top bar. And then when we click it, it shows a drop-down box of the different features of OpenIMIS. So it shows you the product, the health facilities, medical services, items. And for example, we click into the medical items price lists. It leads us to this landing page. So for example, I choose this one, Tahida Government Hospital List. I think this is set, like the demo page is set somewhere in Africa, so it's quite different. But then let's say we click Tahida Government Hospital List, and it shows the list of prices for the different medicine available. And there's also a separate page for the services available also. So this is crucial information, especially for the patient, since they would be able to access beforehand, like what kind of medicine, like how much the medicine would be for them. And so they could also prepare like the amount and how much is being covered for them in their insurance. So it's really convenient. It's a convenient tool for the patients. Let's take a look into a health informatics management component in a medical school curriculum. What are the objectives of the course? One is to explain the importance of health informatics and ethics in providing health care, and that includes confidentiality, patients' information, and their right to privacy, since again, we should always consider the Data Privacy Act in place. Another is to analyze cases in the use of information communications technology to address real-world health management and service delivery challenges. Third is to identify existing gaps to the current challenges in healthcare management and service delivery. And fourth is to recommend ICT-based solutions to the gaps identified in the Philippine setting. Let's now proceed to the scope of the course, which includes an overview of health informatics, where we discuss the definition of terms related to health informatics and health information systems. And we also have bioinformatics and consumer health informatics, although those two were not discussed really in depth. Another adjunct for the course is the public health informatics, which is closely tied to health information systems management, the main meat of our course since this is a management course. And the two highlights under that are electronic health records, EHRs, and clinical decision support. Again, for EHR, we discussed the importance of safekeeping on patients' records, and that we always need to take into consideration confidentiality and privacy of the patients and the Data Privacy Act. Nobody, not one single personnel having access to such patient records should tamper these patient records. So for clinical decision support, it employs a system that can facilitate and assist physicians and other health professionals in their clinical decision-making tasks. So this is like deciding what would be best for the patient. We need to ask questions like, does the patient and/or the insurance of the patient have the capacity to pay for such treatment or surgical procedures? If I were a physician, if I were to ask them to, oh, this condition needs a surgery, will they be able to handle the financial matters on it? And I think this is where OpenIMIS can contribute to the efficiency, since patients, providers, and payers would know how much the fees are, and that this could be a way for less channels for people to go through. And also transparency would be there, since people can see where their money goes, and if that specific condition is again part of the insurance policy, how much of it is covered. So that is really important in terms of the clinical decision support system and safekeeping of electronic health records. What has been done so far? Based from my own personal experience, our learning sessions were mostly theoretical. So early on in the course, we were introduced about specific health information system terms like standards for EHR exchange, such as the FHIR, which is the Fast Healthcare Interoperability Resources. And this FHIR, given as an example, is developed by HL7 International. This FHIR defines data elements to be of common use around the globe and for institutions employing EHR. So they set standards as a common language for those hospitals or other institutions that use electronic health records. And second is we were asked to read journal articles on health information system developments in a global scale. An example of this is applications like WhatsApp is being utilized by physicians in some hospitals in Malaysia for faster communication and to aid for their EHR exchange. Third is we tried to identify hardware, software components, the input and output of the system, and the stakeholders involved in the system, who are accountable and who are responsible for the systems in place. And fourth, we had projects. And since we had different professors, it varied per class. And so for my case, in our group, we created an app in line with healthcare, and which I'll show you in a bit. Here, um, this is a sample of our group's output. We call it Bantay Nanay, or it's like safeguarding the mother, taking care of the mother. And this hypothetical app, supervises or tracks the consultation of pregnant mothers, ideally in a rural setting. And this is just a hypothetical again, so it's not non-existent, but this is how we picture out to be helpful for barangay health centers and far-flung areas with less access to advanced healthcare. So this Bantay Nanay app is catered to maternal health concerns of pregnant women. And yeah, big credits to my group mates for this. And here we see in this menu, health records, schedule, medications, lab results, all of those. And then, so for example, we click on the lab results and the date, specific date, and There we see a window of a list of procedures for the pregnant mother. But the most important feature for our hypothetical app is this calendaring of appointments and scheduling of the checkups for the pregnant mothers. So here, by having such apps, this might go hand in hand with OpenIMIS. And this could be very convenient if our system has that integrative approach in our health services. So yeah, that is one example of our output in our HIMA course. Since we talked about having an integrative approach, let's now see how OpenIMIS can aid students in medical school. First, there should be an extensive discussion on health financing. The mechanism of the interplay between payer, patient, and provider should be discussed in the context of the National Health Insurance System, like PhilHealth. The following questions should be addressed, such as, how do we pay premiums as voluntary members? How about for involuntary members? How often should we pay for premiums? Where do we pay for such premiums? What are the illnesses covered? What is the maximum coverage for a specific package? These are information that should be hopefully be given to us as physicians, especially in the light of UHC, since we are trying to minimize out-of-pocket payment and maximize the health service benefit that they deserve to get without holding such information from the patients. An example for this could be having group activities, such as simulation or case scenarios on health financing schemes. Ideally, the class will be divided into roles, such as payer, provider, and patient. And for instance, a student assigned as a patient would have to enroll in a health financing scheme through OpenIMIS. However, the patient's income is only enough to cover his family's basic needs. His family of 4 lives in a shanty and does not have any knowledge about health insurance policies. How will the insurance payers and the health service provider interact on such scenario and convince the patient of the importance of enrolling into the scheme, of the health insurance scheme, despite the perceived barriers of his living conditions? These activities would encourage critical thinking of students with regards to applicable real-life scenarios that are not new to us as witnesses of our healthcare system. Another activity could be incorporating online workshops to cultivate a better understanding and appreciation from the students about the electronic health records, especially now with the shift to digital or online learning. This can be very convenient by using the demo page similar to what I showed you earlier on how to navigate OpenIMIS, and this is very accessible to anyone. On a larger scale and beyond the school's boundaries, let's discuss how we can apply this in our country. How do we apply this in the Philippines? First, public-private partnerships must be established. It is important that the government, and in my opinion, actually, it's even an imperative for the government to recognize initiatives and support them. An example would be the China West Plus or the Secured Health Information Network and Exchange, which is one of the first mobile health innovations here in our country. It is also an electronic medical record system designed to cater to the emerging needs of rural health units or RHUs and other public health facilities. China West is also where we drew our inspiration from the Mantay Nanay app I showed you earlier. And if I remember correctly, China West Plus is being used in some areas in Iloilo in Central Visayas. But despite that, my impression is that the use of this app is still very discreet in the Philippines. These initiatives are no doubt beneficial for us and to the public since it contributes to the more seamless transactions related to healthcare. However, there is also an apparent redundancy when a lot of developers create the same tools and apps, which allows these systems popping anywhere in the country, leading to a source of confusion for the public, especially when in most cases people tend to ignore the fine print. So just a form of comparison, these are like tons of bus companies along EDSA, all of them heading to the same direction, but whether I'm a tourist or a local, I still get lost on which bus to ride to get from point A to point B, because there is no proper regulation. Same thing goes for the realm of digital health. Thus, there's a need to regulate such apps in our country and make them coordinate and communicate with one another to avoid such redundancy. Nevertheless, the availability of apps like China West Plus shows how we don't always need to import from other countries to have such systems in place. That way, our government can minimize unnecessary spending for costs in developing healthcare-related apps and programs since we already have creative local developers to tap into. Also, ideally, PhilHealth should spearhead, especially with the OpenIMIS initiative, since standards must be set for consistency. If we just let things be and propagate to each his own, then our health information system would continue to crumble because we don't and we wouldn't have a solid foundation of our health financing schemes. Now let's move on to the gaps, as mentioned by Dr. Marcelo in another webinar early this year. So the first is G for good governance. Our country really needs equity, and we have to consider everybody and not just those who are middle class and above, but everyone to benefit from this financing scheme. Next is architecture, which is the design and the blueprint of the system. Third is program management. How can we ensure that anybody can execute and maneuver through this scheme independently and with little assistance from those in charge? Fourth is standards, and standards is for interoperability. Interoperability in terms of healthcare makes it easier for medical service providers to share patient information with one another. We know what data is being exchanged by the user and what data we are consuming, and is also how people understand the process whenever they use the system. So let's now move on to the real gaps, not the gaps that were mentioned earlier, but for example, in rural areas and far-flung areas, there is a lack of digital equipment and devices such as PCs, laptops, tablets. That is important for service delivery if we were to implement OpenIMIS in our health financing scheme. There should be an adequate training for payers and insurance providers, and there should be enough personnel. So health human resources and IT personnel are really crucial, and the quality of training to them must be consistent. And again, there must be a standard set for such trainings to occur. There's also, we also need proper channels in bringing the information to the public and policyholders, like for example, insurance policyholders. How do we make it easier and convenient for them to digest the interoperability and execution of the system? Since again, we mentioned not everyone reads the fine print, especially those who are part of the uneducated class of our country. So that is really one of the major challenges. How do we bring those information to them? Like, do we tap on the media? Do we tap on social media? And all those possible ways to educate them on how to use the system. Lastly, internet connection is a very bad problem also in most places in our country. So there is a need for a stable and reliable internet connection if we were to safekeep such patient records and store them in a cloud-based mechanism. So that is all for my presentation. Thank you very much. I hope you learned something from what I discussed as the role of OpenIMIS in the Health Informatics Management course in a medical school curriculum here in the Philippines. Thank you and stay safe.
Thank you, Nicole, for bringing this presentation together. So if you have comments or suggestions, please feel free to leave them in the chat box. Let me read the two messages from Dr. Keisha. So she's sharing that WhatsApp is used by healthcare professionals because the need has preceded the technology, but from a data protection point of view, it should not be used to share healthcare information. And then Dr. Keisha also has a question. Is OpenEHR one of the technologies discussed in the course? I think, Dr. Keisha, this presentation shared by Ms. Nicole is not yet implemented as a course. They're just trying to introduce or incorporate OpenIMIS in their current curriculum. But Nicole, is OpenEHR already being introduced to you in your health informatics course?
Okay, so hi, Dr. Keisha. Actually, EHR as a concept was discussed in our health informatics management course. However, the focus is on the management aspect, so we did not have any specific discussion on the open EHR, but on the gist, on the main gist only of the EHRs and how important it is for us in the management aspect.
We
I
have a
think,
new
yeah.
message. Yes, from Dr. Chamika. What are the strategies implemented to ensure acceptance of OpenIMIS when it comes to administrators and other policymakers? Would you have an answer to this, Miss Nicole? Because I think this should be passed on to your professors.
Yes, Mr. So hi, Dr. Tramika. Actually, I'm presenting based from my perspective as a medical student. So currently we don't have any systems in place yet to implement OpenIMIS. That's why we're trying to introduce it first to the administration of the school. So right now there are no solid strategies yet, but we're hoping that by introducing OpenIMIS to our management course, like one of the subjects I mentioned, like health informatics, we hope that by doing workshops regarding OpenIMIS, they would incorporate it to the different med schools, not just in our school alone.
Yes, thank you, Nicole, and thank you, Dr. Chamika, for your messages. We're hoping to bring another presentation with you, with the professors of Miss Nicole in the future, maybe. So we hope we can do
Hopefully.
that.
Oh,
Okay,
there's
so we have a question, yes, from Sir Art. Hi, Sir Art. So, hi, Nicole, great presentation. So, as a medical student, what essential knowledge and skills do you think are needed to competently or confidently use HMIS, such as OpenIMIS?
Hi, Sir Art. Thank you. Thank you for appreciating. As a medical student, I think knowledge and skill, I think is very important to be able to communicate well to your team or to the audience and public. And as a medical student, you have to coordinate with the team well. And aside from that, we have to really know what is the essentials of the open IMIS, because you wouldn't be able to communicate it well without knowing it beforehand. So we, I think the hard skills of knowing how to navigate through the system, and by doing the workshops and going through the demos, that would be really helpful. And yeah, I think that's one of the main skill that is needed as a medical student in terms of confidently using OpenMS before we communicate it to the other sectors like the barangay health center and yeah, beyond the school aspect.
Yes, thank you, Nicole and Sir Art. Sir Art is also working on a part of the student module for OpenIMIS, so we hope to learn from that soon. All right, I think we can wrap up this session. So thank you once again, Ms. Nicole, for bringing this presentation to us, and all our participants for joining us tonight. So we look forward to having you again in our upcoming webinars, and keep safe. Good night, everyone.
Thank you so much, and thank you also to my friends and batchmates. Thank you, guys.